Favipiravir. Favipiravir, also known as T705 or Avigan, is an antiviral drug being developed by Toyama Chemical Fujifilm Group of Japan with activity against many arenaviruses. In February 2020, Favipiravir was being studied in China for experimental treatment of the emergent COVID-19 novel Wuhan coronavirus disease. Like certain other experimental antiviral drugs, T1105 and T1106, it is a pyrazinecarboxamide derivative. Favipiravir is also active against influenza viruses, West Nile virus, yellow fever virus, foot and mouth disease virus, as well as other flaviviruses, arenaviruses, bunyaviruses and alphaviruses. Activity against enteroviruses and Rift Valley fever virus has also been demonstrated. Favipiravir showed limited efficacy against Zika virus in animal studies, but was less effective than other antivirals such as MK608. The agent has also shown some efficacy against rabies, and has been used experimentally in some humans infected with the virus. The mechanism of its actions is thought to be related to the selective inhibition of viral RNA-dependent RNA polymerase. Other research suggests that Favipiravir induces lethal RNA transversion mutations, producing an unviable viral phenotype. Favipiravir is a prodrug that is metabolized to its active form, favipiravir ribofuranosyl 5-triphosphate, Favipiravir RTP, available in both oral and intravenous formulations. Human hypoxanthine guanine phosphoribosyl transferase, HGPRT, is believed to play a key role in this activation process. Favipiravir does not inhibit RNA or DNA synthesis in mammalian cells and is not toxic to them. In 2014, Favipiravir was approved in Japan for stockpiling against influenza pandemics. However, Favipiravir has not been shown to be effective in primary human airway cells, casting doubt on its efficacy in influenza treatment. Ebola virus disease. The drug appears to be effective in a mouse model of Ebola virus disease, but its efficacy against human Ebola infection is unproved. During the 2014 West Africa Ebola virus outbreak, it was reported that a French nurse who contracted Ebola while volunteering for MSF in Liberia recovered after receiving a course of Favipiravir. A clinical trial investigating the use of Favipiravir against Ebola virus disease was started in Gugadu, Guinea, during December 2014. Preliminary results showed a decrease in mortality rate in patients with low to moderate levels of Ebola virus in the blood, but no effect on patients with high levels of the virus, a group at a higher risk of death. The trial design has been criticized by Scott Hammer and others for using only historical controls. The results of this clinical trial were presented in February 2016 at the annual Conference on Retroviruses and Opportunistic Infections, CROI, by Daouda Sissoko and published on March 1, 2016 in PLOS Medicine.